your name?
Noah Green.
And your date of birth?
1/31/97.
Okay, 23. All right, the first thing I'm gonna do is just look at your face. Okay, so there's no drooping in the corners of your mouth. Your mandible jaw looks good. There's no abnormal movements. Looking straight on. Okay, so your lips are staying together. There's no drooling. Everything looks symmetrical. Nothing is spasming. Nothing is drooping or deviating to one side. All right, now I want you to smile like this. Okay. So your lips look good. The corners of your mouth aren't deviating to one side. All right, now open your mouth. Wider. Okay, close. Okay, that looks good. Again, the jaw's not deviating. Now I want you to raise both your eyebrows like this. Okay, good. And then I also want you to close your eyes as tightly as you can. Okay, open, and do it one more time. Close, and open. Good job. Okay, good. Okay, the next thing I'm gonna look at is just your mouth. So again, look straight on with me. I'm actually gonna use this flashlight. Okay, so your lips look good, very good color. The tissue in your lips look good. There's no sign of drooling. Your lips are staying together, they look healthy. There's no evidence of a repaired cleft lip. All right, again, I'm gonna ask you to smile. Still no deviation, which is good. Now I want you to pucker like this. Good. Okay. All right, now I want you to alternate between the pucker and the smile. So go as fast as you can. Okay, good. So you have a good range of motion. All right, now I want you to puff out your cheeks and hold your breath for 5 seconds. And don't let air come out of your nose or your mouth. Good. All right, now I want you to say ooh ee as fast as you can.
Ooh ee ooh ee ooh ee ooh ee ooh ee
Good.
ooh ee.
Okay. All right, the next thing I'm gonna look at is your tongue. So if you wouldn't mind just sticking your tongue out. Good, okay. So it has a good color, it appears very normal, and it's an appropriate size, not too big or small for your mouth. All right, I want you to stick it out one more time and just make sure. Okay, so everything looks strong, there's no atrophy, there's no abnormal movements or spasms. All right, now I want you to protrude your tongue as far out as you can and don't rest on your bottom lip. So, like that. Stick out towards me. Good. Okay, so again, that looks good. Okay, now I want you to stick your tongue out and I want you to go side to side like this. As fast as you can. Okay, good. All right, so there's an appropriate range of motion. All right, now I want you to stick your tongue out towards me for 5 seconds. So just stick it right out at me so it's not resting on your bottom lip. Okay, good. So the tongue is strong. And it's not resting over your bottom lip, which is good. All right, now I want you to protrude your tongue again, and I want you to move it up and down as fast as you can. Good. Now side to side. Good. Okay, so still at appropriate strength. No sign of an uncoordinated movement or weakness. All right, now I want you to stick your tongue, and I want you to pull it back in as fast as you can. Do it again. One more time. Good. All right, so a good speed and range of motion. All right, now I want you to open your mouth and I want you to lift your tongue up so I can see underneath your tongue. Good, okay. So you have a normal sized frenulum. It's not small, it's not too big. All right, now I want you to say la 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 la.
La 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 la.
Okay, good. And I want you to say ka 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 ka.
Ka 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 ka.
And say ka 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 one more time.
Ka 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 ka.
Okay, good. All right. So your tongue was strong and didn't have any trouble producing those sounds. Okay, so now we're gonna go to your hard palate. So if you don't mind looking at me, and then I want you to tilt your head up and open your mouth as wide as you can. I'm just gonna look at your hard palate. So your hard palate has good coloration. Everything is symmetrical. The grooves on the front of your mouth look good. Okay, so I'm gonna mark that off. The height and the width looked good. There's no sign of unrepaired cleft. No surgical damage or any surgical removal. Perfect. And no dentures or any other obstructions. Okay, now I'm gonna look at your soft palate. So again, I want you to look at me. I just go, look up a little bit. There you go. Okay, good. All right, so the coloration looked really good. You do not have a split uvula. There's no sign of clefts or fistulas. Let's see here. Everything is symmetrical, including the velum. And the velum is a significant length. And there was laryngeal closure when you said, which is good. Okay. Now I'd like you to produce the ah sound, and I'm again going to look. Good. Okay. So I wanted to check again, but your velum does move up and back when you're saying that. You do have your left tonsil is bigger than your right tonsil, but it doesn't seem to be inhibiting your speech at all. Okay. All right. Now I want you to open your mouth, and I'm just going to look at your teeth. So keep your tongue in your mouth. Okay, good. Look at your teeth. Now open your mouth. I'm going to look at the bottom teeth. I'm going to look at the top. Okay, now I'd like you to bite down again and smile so I can see your bite. So you look like you have a very normal bite, not an open bite or a closed bite. All of the teeth look like they were where they need to be. They're jumbled. Alright. No dental appliances, no missing teeth. So I'd say you have very normal occlusion. Your molars rested where they needed to rest, and you had a good bite. So the last thing we're going to do, so I am going to actually get my timer out, and what I'm going to have you do is I'm going to have you say puh, 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 as fast as you can, and I'm going to time you for 10 seconds. So you just want to practice for seconds. Say puh, 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 puh.
Pa 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 pa
Good.
pa.
Okay, now I'm going to time you. All right, ready? Now I want you to say it as fast as you can, but as clear as you can. All right? All right, go.
Pa 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 pa.
Stop. Good. All right, this next one is t t t t t t t t. Okay, ready? Go. Good. All right, this next one is ready? And go. Good. Stop. All right. Good. All right. This next one is f f f f f f f f f, and I want you to make that sound. Okay.
Okay.
All right. Ready? Go. Good. All right, we're almost done. So this next one is la 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 la, that O L sound. All right,
Okay.
ready? Go.
La 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 la.
Stop. All right, good. Now you have one more, and this one's a little bit trickier. It's 3 syllables, so it's p t k.
Pataka.
Yep. So as fast as you can, 10 seconds. All right, ready? Go.
Pataka 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 pataka.
Stop. Good.